The Trump administration announcing today it is imposing a nationwide freeze on any new Medicare enrollments by hospice and home health agencies. It is part of its sweeping fraud-busting initiative in federal health programs. The move is part of Vice President J.D. Vance's anti-fraud task force, which has been taking more aggressive steps to investigate states before the November elections.
Jay Jarvis has more on how this could impact Floridians.
Fortunately, this will not affect seniors who rely on Medicare for their health care. However, this will affect new businesses that are trying to enter the marketplace. Millions of seniors nationwide get home health services through Medicare.
People who may be discharged from the hospital because they've had a stroke or they have had a hip replacement and they need ongoing care when they get home, rely on Medicare's home health benefit.
So the latest headline regarding the agency might cause some alarm. The Trump administration is placing a moratorium on new Medicare enrollments by hospice and home health agencies, citing systemic fraud in those spaces.
The point of this is to put a pause on new agencies bubbling up to the surface that may or may not be legitimate.
Tricia Newman is the executive director of the Medicare Policy Program for KFF, a nonpartisan health policy organization. She says despite this, seniors can still utilize services from companies that are already in business.
Of course, there may be a need for legitimate home health services and new agencies in the future, but there's no evidence that there's a shortage now. There are plenty of agencies now. And so I don't think this is a reason for people to be worried.
Newman says those most affected are those who are trying to open new hospice and home health agencies who may now have to delay those plans as the government's investigation proceeds.
In some ways, people in Medicare should be a little bit happy that the government is doing more to protect the program and to protect taxpayers, because if fraudulent payers are billing Medicare, that affects the Medicare Trust Fund, which needs to be solvent in order to pay out all benefits.
This nationwide freeze on new hospice and home health agencies is set to last for 6 months. Jay Jarvis, WPBF 25 News.